In a Fox Carolina Fact Check, weight loss pills could soon be available to you. So we are joined today by Dr. Bijoor from Oakville Medical Associates in Greenville. As always, thank you for being with us on this Monday. So we're going to fact check the pros and cons of what we know so far about this medication that could be coming out. So these GLP-1 pills instead of an injection, they're in some trials right now. Tell us about what's going on there.
So there are two big main options there. Eli Lilly has a medication called orforglipron that's in trials right now.
Okay.
And it basically is a small molecule, non-peptide-like molecule that can be taken on an empty stomach or with meals. So it's very flexible in terms of dosing. And it has gone through a trial called Attain trial, where it's a 72-week trial, and they've seen about 12% weight loss with that medication.
Okay.
And the other part is the Achieve trial, which is where they took diabetics and they found a 1.3 to 1.6% reduction in the A1C. So that's really exciting. And they lost about 8% body weight as well.
Wow.
Yeah.
And that's just for the Eli Lilly.
Yes, absolutely.
And there's another one as well.
The other one is by the other company, Novo Nordisk, which has an oral semaglutide. You know, we've had the Rybelsus, which is already the diabetic oral semaglutide.
Okay.
Now they've come out with a higher dose. That's a 50 milligram dose that's going through trials called the Oasis trial. That is showing about a 15% weight loss. But the catch is this medication has to be taken on an empty stomach. So a little bit of, being careful there with the dosing.
Sure.
And cannot be taken with any other medications for about 30 minutes.
Okay, so there are some differences so far. And these are just in their trial phase. These are not officially approved yet.
They're not out yet, but they are probably scheduled to be out by the end of this year or early next year.
Okay. Are we seeing the effectiveness to be similar to what the injection is so far in these trials?
So far, so the injectables, Wegovy had about a 15% weight loss.
Okay.
The Zepbound has about a 22 to 24% weight loss. So compared to that, the oral ones have about 12 to 15% weight loss. So not as much as the injectables, but still it's a pretty significant amount of weight loss, especially, if you're looking to lose a little bit of weight, it's a good start. And I always am a firm believer that this goes in hand with lifestyle modification. So then it becomes really effective.
Right, just changing your lifestyle, maybe moving your body a little bit more, eating healthier. When you combine all those things, it's a little bit better. You're setting yourself up for success, which is so important. And do you think being an oral pill, would that make people a little bit more likely to try this rather than an injection? Because needles can be a little iffy.
Absolutely. Who wants to take a needle when you can have an oral option, right? So preliminary studies have shown about 75% of the people out there do want to take an oral medication, so that's exciting. Flexibility of dosing, you don't have to refrigerate it, you don't have to use all the sterile techniques and injections. So I think we need more options, so this is a great place to have options for different types of people. And there are some concerns. I mean, the oral, when you take it orally, the stomach, it delays your gastric emptying, right? So what that can do is if you take other oral medications, it could potentially affect the absorption of the other ones because you're letting it stay in the stomach for a longer time. So that's one concern. But overall, I think we'll have to see what the cost would be. And
well, we'll wait. We have only a few more months until the end of the year, which is crazy to think about. So we'll keep our eye on these medications into 2026, and then we'll go from there. Dr. Bijoor, thank you.
You're welcome. Thank you.